Now we are going to talk about the staging, diagnosis, and treatment of non-Hodgkin lymphoma. Let's take a look at Ann Arbor staging system. This is designed for Hodgkin lymphoma. Staging for non-Hodgkin lymphoma also use this system. Stage 1 refers to involvement of a single lymphoid region or a single non-lymphoid site. Stage 2 refers to involvement of 2 or more regions on the same side of diaphragm. Stage 3 refers to involvement of 2 or more regions on both sides of the diaphragm. Stage 4 refers to spread of disease from lymphoid sites to non-lymphoid organs, involvement of more than one non-lymphoid organs. Each stage is further modified as B by the presence of fever, weight loss, night sweats, or other B symptoms. The International Prognostic Index, IPI, was first designed for diffuse large B-cell lymphoma and later used for many types of B-cell lymphoma. There are 5 points. Each point 1 score. They are age more than 60, LDH concentration above normal, ECOG performance status more than 2, Ann Arbor stage 3 or 4, number of extranodal disease sites more than 1. If the score is 0 to 1 point, it indicates low risk. 2 score indicates low to intermediate risk. 3 scores indicates high intermediate risk. 4 to 5 score indicates high risk. Next, let's talk a little bit about the differential diagnosis of lymphoma. The first one is other lymphadenopathy. It would be lymphadenitis, metastatic cancer, or tuberculosis. The second one is fever as its main manifestation. Tuberculosis, bacterial infection, connective tissue disease, necrotizing lymphadenitis. The last one is extranodal mass. It may be other malignant tumors in corresponding areas. Generally speaking, the treatment of lymphoma includes chemotherapy, radiotherapy, immunobiological therapy, hematopoietic stem cell transplantation, operation, and others. There are many kinds of chemotherapy regimens which are closely related to the pathological type, stage of the disease, initial treatment, or treatment of relapse and refractory patients. Not all the lymphomas need treatment. For indolent, early stage, asymptomatic patient, there is no treatment indications. Radiation therapy is very effective in destroying sites of bulk disease. Relatively low doses will result in spectacular regression of a localized tumor mass. However, since non-Hodgkin lymphoma is most often disseminated disease, chemoimmunotherapy combinations have shown greater efficacy, such that the role of radiotherapy is now restricted to palliation or directly at restricted sites of symptomatic disease in elderly patients. Radiotherapy is an effective treatment for some lymphomas, For example, patients with large masses, early follicular cell lymphoma, NKT cell lymphoma, nosal type 1 stage, primary cutaneous and plastic large cell lymphoma, local lesions, etc. The most popular immunobiological therapy is CD20 monoclonal antibody, which can significantly improve the efficacy and prognosis of many lymphoma, such as chronic lymphocyte lymphoma, diffuse large B-cell lymphoma, follicular lymphoma, marrow lymphoma, and Burkitt lymphoma. Hematopoietic stem cell transplantation can be used as salvage therapy or intensive consolidation therapy for some pathological types of lymphoma. The status of surgery in the treatment of lymphoma has declined. Operation is recommended only in some specific situations, like diagnostic surgery, or to solve clinical symptoms when patients suffer from gastrointestinal perforation, bleeding, or splenectomy for patients with splenic marrow lymphoma. So, non-Hodgkin lymphoma therapy must also be tailored according to the disease subtype and the presence of complicating illnesses, and the age, the performance status of the individual patient. In many situations, these patients will be treated according to strict research protocols. Successful treatment of lymphoma also requires a high-quality blood transfusion service to provide red blood cell and platelet support, and expert management of immune-compromised patients. That's all. Thank you.